Howdy guys, Tony Merwin here over at Precision Senior Marketing. I'd ask some of you if you wanted to hear just kind of a basic high-level overview of Medicare, kind of what the program is, how it works, and then how maybe you as an agent can capitalize on it, whether it be your primary focus or even just a secondary focus, or maybe just setting up a referral partnership. So first and foremost, I'm not going to have any visual aids on this video, so if you are interested and you want to kind of pay attention, you might want to go get you a notepad and pencil or pen and just, take some short notes that might help you out. But first and foremost, probably the biggest thing to understand about Medicare, number one, it is a federal health insurance program designed for people age 65 or older. You can also qualify for Medicare if you're drawing Social Security disability income for at least 24 months, you would qualify. And then, or if you have end-stage renal disease, certain other disabilities, and Lou Gehrig's disease. But primarily, and certainly for the focus of this video, we're talking about everybody that's turning 65. And if you're living under a rock or just not paying attention, Medicare is blowing up right now, and it's really been blowing up for a while, but we're really in the big crux of it, so to speak, right now. There are 10,000 people turning 65 every day nationwide. We are about 4 years into that period, and that's going to last for about another 4 years before it slows down. And when it slows down, it's not going to slow down much, just won't be a full 10,000 people every day. So again, market's exploding. So even if you're not selling Medicare primarily, you can still capitalize on a piece of that, because with the sheer number of people that are turning 65, the truth is we don't have enough agents to service all of them. And that is evidence if you look at some of what's happening in the space with some of these bigger companies, institutional type companies that are coming into the Medicare space. We've got huge call centers that are opening up. Walmart's getting involved. Google and Amazon are starting to get involved. There was a small, I shouldn't say small agency, but there was an agency out of Indiana that recently rounded up $100 million in funding to expand their agency in multiple states. So that alone should tell you that the opportunity is huge for anybody that wants to get a piece of the action. So again, federal health insurance program for people age 65 and up, 10,000 people turning 65 every day nationwide. Now, how Medicare works is pretty simple. Going to give you just a real simple high-level overview of it, okay? It's basically kind of like an 80-20 program, right? Once you're in Medicare, Medicare generally pays 80% of the tab. You're going to pay 20% of the tab as a consumer, right? Medicare has two primary parts, what is known as Part A as in apple, and Part B as in boy. Part A is the hospital insurance. Part B is the medical insurance. Those two pieces create what is known as Original Medicare. So again, Original Medicare, you can go anywhere in the nation, any doctor, any hospital, any provider that accepts Medicare, which is about 99% of them. Medicare covers 80% of the tab. The consumer is on the hook for 20%. And if you understand people that are turning 65, some of them have a lot of money. Some of them don't have a lot of money. They are living on that Social Security stipend. So that 20% can be a big chunk of change, right? The average hospital stay in Texas for 3 days is about $12,000. So a lot of senior citizens, they're not ready to pony up 20% of that. So a lot of them will purchase a Medicare supplement policy, which is designed to cover some, or in some cases, all of that 20% gap or co-insurance. Medicare supplement policy, also known as a Medigap policy. There are multiple Medicare supplement policies. I am not going to get into all in this video, but generally speaking, the two most popular ones are Plan G, as in giraffe, and Plan N, as in Nancy. And small premium, like in Texas, for example, you can pick up a Plan G for about $105. They can pick up a Plan N for about $85, and that's going to cover the majority of that 20%. Also, when they enroll in a Medicare supplement or Medigap policy, it doesn't affect where they can go get service. They can still get service anywhere they want in the nation, right, as long as that doctor accepts Medicare. The doctor doesn't care if your Medigap policy is with Aetna. He doesn't care if it's with Blue Cross, Humana, Gerber, or Polish Falcons of America. He doesn't care. All he wants to know is that you have a little red, white, and blue Medicare card. Because when you go to the doctor, you're going to hand them your Medicare card. he will bill Medicare, and then Medicare will then electronically cross over the portion of the claim that's due from the Medigap policy or Medicare Supplement Insurance Company. Pretty simple. Outside of that, for people that do have a standalone Medicare Supplement or Medigap policy, they generally need to get a standalone drug plan. Those can get pretty confounded, but thankfully nowadays with technology, there's awesome software solutions that can help you figure out all the different drug plans that are out there based on that customer's needs, the different prescriptions they're taking, etc. So that's become super simple, and any agent that's selling Medigap policies truthfully should be selling drug plans as well. Fairly simple. The other side of Medicare that a lot of people have heard about is called Medicare Advantage, and it is growing extremely rapidly right now. Last year, during the annual election period at the end of the year, which is the period of time between October 15th through December 7th, everybody that was turning 65 and coming into that phase, they chose Medicare Advantage at about a 4-to-1 rate over original Medicare and a Medicare supplement plan. You'll hear a lot of arguments about which one's better. Is Medicare Supplement better? Is Medicare Advantage better? Not here to get into that argument either. Again, just kind of giving you guys a high-level overview of it. Medicare Advantage, for all intents and purposes, is basically a privatized version of Medicare. So once you've enrolled in a Medicare Advantage plan, Medicare's no longer paying the claims. Your Medicare Advantage company pays all the claims. Whether it's Humana, Aetna, United Healthcare, Blue Cross, doesn't matter. Whoever your Medicare Advantage is, you're going to get a little card from them. And now, instead of handing your doctor the red, white, and blue card, you're going to hand them your Medicare Advantage card. And then he will bill Humana, or he will bill United Healthcare, whoever it is. All right? The Medicare Advantage products are a network-driven plan. They are generally all-inclusive. They'll cover your your hospital, your medical, your drugs. Some of them have additional benefits like dental and vision and hearing aids, flex cards that help you with grocery shopping or over-the-counter benefits at the pharmacy, all kinds. They're loaded up, all right? But that is basically, again, a privatized version of Medicare that's network-driven, right? HMO, PPO, HMO, POS type products, all right? So again, original Medicare, Medicare Supplement, go anywhere you want in the nation that accepts Medicare. Medicare Advantage, you got a network that you got to stay within. You get outside of the network, cost goes up, or you may even have to pay all of it, right? Fairly simple, okay? The other big deal is the money, right? Why do we like to sell Medicare products? Because of the renewal stream, right? Same reason a lot of us are in insurance anyway, right? Sell a product, get paid once, sell insurance, get paid for life, and that's really what makes Medicare attractive as far as an industry or a space that agents want to play in. So as if you're an independent broker playing all by yourself, I'm not talking about agency type commissions, I'm not talking about FMO level stuff, just if you're an agent and you're selling products that surround in the Medicare space, okay, here's how it kind of works. Medicare supplement plans, on average, you're going to make around $300 a rip. Okay, that's first year and renewals. $300 every year that policy stays on the books per the term of the contract or the commission schedule. And in most states, that is a 6-year period before that renewal starts to drop off. So not only are you going to get plus or minus $300 first year, you're going to get around $300 second year, third year, fourth year, fifth year, sixth year, and then it starts to taper off. Now in Texas, that level commission is 7 years. Indiana, it's 8 years. I believe Ohio, it's 8 years as well. All right, but most states, 6 years, and then you'll have a small trailer commission for a few more years. The bulk of your commissions on a Medicare supplement policy are for 10 years, right? Most of the contracts out there for the independent broker and agent don't pay after 10 years. And if they do, it's really minimal, like a 1% trailer, and that's it. So I find a lot of agents that are really savvy, every time their book of business gets to around the 6th year, they start calling those healthy clients again to roll them into a new Medicare supplement plan to start their commissions back over again. All right? Fairly simple. All you need to sell Medicare supplement products is a health license. That's it. Don't have to do any extra certifications, no extra training, just need a health license. Medicare Advantage world, a little bit different. Commissions are a tad better. and I'll get to that in a second, but you do have to do some certifications. The primary one is known as AHIP, which is AHIP, stands for America's Health Insurance Plans. That is an annual certification that you as the agent have to maintain, not only to continue writing new business, but to continue getting the renewals from the business you wrote previously. AHIP certification is $175 a year, although it's pretty easy to get a discount on it. We have a discount for $125, which is the lowest price you're allowed to get it for, as far as it saves you $50. Carriers have carrier-specific discount links that you can get into to save you some money on AHIP. But number one, if you want to sell Medicare Advantage products in that space, you got to get AHIP certified. Beyond that, once you're contracted with any specific insurance company, United Healthcare, Humana, Blue Cross, Aetna, WellCare, Molina, whoever it is, they have some product-specific training and certifications you have to do. Some are certainly more lengthier than others, right? I just recently completed certification for one carrier that took me probably 10 minutes. United Healthcare tends to be one of the longer ones that probably take you a couple hours if you try to sit down and do it all in one shot, right? But that is a requirement to sell Medicare Advantage. Sometimes agents shy away from that because I don't want to do all that every year. Nah, you really should, because number one, if you really do want to get into the Medicare space, you want to be able to do both sides. You want to be able to sell Medicare supplements. You want to be able to sell Medicare Advantage products if you really want to do your client a great service. Although I will say, there are agents out there, I work with quite a few, that only sell Medicare supplement plans. They refuse to sell anything else. They market specifically to areas where Medicare supplement plans are hot, and they know that they've got not only the best penetration for their product in that area, but excellent rates. And they make a great living just selling nothing but Medicare supplement as far as the Medicare piece goes, right? They'll sell other products to them, hospital indemnity, cancer, final expense, whatever. But all they're doing in regards to marketing Medicare is Medicare supplement. You can do that, right? Not saying you can't, you certainly can. But if you're going to be a Medicare agent, you really need to kind of get the whole pie. Medicare supplements, drug plans, Medicare Advantage plans. Now, coming back full circle to the Medicare Advantage commissions, they are a little bit different and they can be a little more handsome. So like I mentioned, your Medicare supplement commissions, right, on average, $300, and that depends on the state you live in, the contract level that you're in, and the premium that the client's paying. Because on the Medicare supplement side, your commissions are a percentage of the annual premium, like most products that we're used to in the insurance space. The Medicare Advantage side is different altogether. It is a flat dollar rate per app, regardless of who you sell. Doesn't matter if you sell Blue Cross, Aetna, Humana, United Healthcare, WellCare, Molina, whatever. Doesn't matter. You get paid the exact same dollar amount, period, regardless of who you sell. And that commission is, in most states, there are a couple of states that's a little higher, California and New Jersey, for example, but in most states, as an independent broker-level agent all by yourself, you're going to make $539 first year per app and a $270 lifetime renewal. Now, that is based on what is called new to Medicare commissions. So if they're brand new to Medicare, brand new to Medicare Advantage plans, never been enrolled in one before, that's your commission. $539 first year, $270 lifetime renewal, as long as they're obviously on the books. If it is a replacement plan, maybe they had Humana, they've been in Medicare for a while, and they had Humana, and now you're moving them to United Healthcare because it's a better plan, better network, better doctors, whatever it might be, that is a replacement rate. So you get $270 first year and $270 lifetime renewal. Now, a couple of things that are happening outside of the growth of Medicare that I think are really important right now, especially for the state of affairs in the future, is that something that's important that you understand is that Medicare Advantage plans are subsidized by the federal government, by Medicare, by an entity known as CMS, Center for Medicare and Medicaid Services, right? So for every enrollee that a Medicare Advantage plan picks up, the government pays them a subsidy for every month that that person's on the books. Fairly simple, okay? Well, not only does the richness of the plans, right, how much benefits they can offer, but the service areas that they offer their plan in and the commissions that they pay to you depend on the size of that subsidy. For the last several years, the government subsidy to Medicare Advantage plans has been going nowhere but up. And this year, coming up for 2022, they're actually getting the biggest increase in subsidy they've ever gotten. Doesn't sound like much, it's 4.08%, but that is the biggest bump in subsidy, right? If you think about it just as a 4%, doesn't sound very big, but when you compare it to millions of enrollees, it's a lot of money out there that they're talking about. So understanding that, next year, not only are the benefits getting richer in Medicare Advantage, not only are the service areas going to grow again in Medicare Advantage, more doctors, bigger networks are going to get attracted to them, because with that subsidy, that also means they're going to be able to pay the doctors more, but they're going to be able to pay you more. So every time that I've seen in this industry where the subsidy in Medicare Advantage plans goes up, commissions go up too, which is always nice. So I'm expecting to see a pretty nice increase in commissions to the agent this year on the Medicare Advantage side. So that's great. Unfortunately, that has nothing to do with Medicare supplement products. Those commissions have pretty much been consistent ever since I've been in the business for 17 years. When I was writing Medicare supplements 16 years ago in the field, they were paying on average in Texas 21, maybe 22% was a pretty good street level contract, and that's 22% of the annual premium. Your average annual premium in Texas is around $1,500. So again, that's where I got my $300 number from, right? In other states, premium's a little higher, and you might actually make a little more money, right? Like Missouri, for example, average premium is probably closer to $1,800, I would think, somewhere right in there. So you're going to make a little more money in that state. Florida, average premium's closer to about $2,200, $2,400, right? So you certainly make a little more commission there as well. But that percentage has always stayed the same. It has not changed. It's been 20 to 22% for the last 15, 20 years, right? But the premiums have gotten a little higher over inflation. So commissions have kind of gone up, somewhat because of that. But that's pretty much Medicare in a nutshell, as far as you as the agent understanding the opportunity, seeing what's out there, the Medicare supplement side, the Medicare Advantage side, what is needed in both sides. Now, obviously, if you want to go out and get a piece of the business, you can, right? Whether it's a primary function of your business, right? And you're marketing Medicare regularly, or if it's just secondary, maybe you're just picking up the people that are in your P&C agency, for example, that are already 65. So instead of referring them out, you've learned how to now maybe get a Medicare person in your office, or you've learned to tackle it during the heightened times, or just to cross-market to those folks. But there's another way that you can capitalize on Medicare without selling any of it, and that's through referrals, right? There's a lot of great agents out there like myself, like agents that I work with, that's all they do. They're specialists in Medicare, and maybe you're not. So instead of you taking the time to learn it, you would just rather refer the people out of your book or people that ask you about it to a reputable agent. Well, the good news is those agents are absolutely allowed to pay you a referral fee, albeit capped, okay? If they're selling MedSup, there's actually no cap on those. But if they're selling Medicare Advantage plans, the maximum amount they can pay you as a referral fee is $100. If it's a drug plan, it's only $25, right? But most people aren't just going to get referred out and then just buy a drug plan. They're usually going to get a MedSup and a drug plan or a Medicare Advantage plan. So as an agent, referring out your clients or your prospects or your book to a reputable agent can certainly pay if you build a really good referral partnership. And again, you can make $100 an app. Pretty simple as a referral fee. That's the most an agent's allowed to pay you. And that's per CMS guidelines. They manage all of that stuff. The commissions on the Medicare Advantage side, the maximum referrals allowed, and so forth. So hope that kind of makes sense for you guys. If you have any questions about this, feel free to hit me up in the group. Feel free to find me on Facebook, shoot me an IM, or even look me up over here at Precision Senior Marketing. Always happy to help in any way I can. So I hope you guys enjoyed the video, and ultimately, I hope you guys will come out and get your piece of the action in the Medicare space. Y'all have a great one, and I will see y'all on the flip side.